Dr. Alecia Macrow. This is Endo Untangled, our podcast where we explore and untangle the world of endometriosis and pelvic pain, and for those who are suffering. What is Endo Untangled for you?
Endo Untangled is just, for me, a wonderful opportunity to explore the world of endometriosis and pelvic pain so that we can help make a difference to anyone who might be suffering from endometriosis and pelvic pain, someone who loves someone with endometriosis and pelvic pain, or also for a health practitioner who might be working in this space or might be developing their skills in this space.
So it's not just about endometriosis, it does include pelvic pain.
That's right. I mean, endometriosis is one of those things that is being discussed a lot in the media at the moment and in social media and in so many other platforms, which is so important. But there is a distinction. So there's endometriosis, which is, I'm sure we'll talk about it, which is a condition where pieces of endometrial-like tissue end up in a place where they shouldn't be and can cause all sorts of problems. So that's endometriosis, and we're going to talk about that in a lot more detail, of course. There's also pelvic pain, and if you've suffered with pelvic pain, that might be pain, obviously, anywhere in the pelvis. So it might be period-type pain, it might be bowel-type pain, it might be intercourse-related pain, bladder, vulva, back pain, so many things, and it affects a whole person and their whole body and their whole life. And that often happens with endometriosis, but you can have endometriosis without pelvic pain and you can have pelvic pain without endometriosis. And that is the tricky field that we are looking to explore with this podcast.
And why this podcast, and why endometriosis and pelvic pain? What's your connection or story with this?
So as you know, I'm a GP and I work in this space. So I run a practice, Thrive Family Practice, where we've been lucky enough to be the recipients of a federal government grant to help reimagine care in endometriosis and persistent pelvic pain. What I don't talk about much is that I have had endometriosis myself. So I feel like I come to this conversation from both sides of the desk. I'm lucky, I would say, that my endo-pelvic pain's been really managed well for the last at least, say, 10 years. So I'm not in the thick of this. I've managed to go through it and come out the other side. But I'm in my 40s now, but rewind the clock 20 years and I was in the thick of this. I was suffering with issues to do with fertility. I had bowel issues. I had terrible period issues, headaches, so much life interruption from pelvic pain and endometriosis. And one of the things that I'm really hoping for is that you and I, with this podcast, can develop a resource that I would have loved to have had access to 20 years ago.
Absolutely. I think that's so important that we allow this exploration and unpack lots of information and education and what it means to you personally out there if you're listening. If you do have endometriosis and pelvic pain, I know that I have not been diagnosed formally, but as a teenager and young woman, experienced a lot of these symptoms, and there at the time was not a lot of help. And I accepted that was part of being female, and you just had to put up with it.
And we're talking for you, if you're talking about being a teenager some time ago.
A very long time ago.
Yes, but unfortunately, I mean, while the scene has changed somewhat, it's not unheard of at all. In fact, it's actually quite common for women to still be struggling looking for a diagnosis.
Absolutely.
And so many women out there would have endometriosis and be undiagnosed and unsupported.
Yeah, absolutely. And we're hoping to change that with this podcast.
Yeah. So I guess let's turn the table round, Cherie, and hear a little bit more about you. So you're not a GP. You're an exercise not everybody needs to or wants to be a GP. You're an exercise physiologist. Why do we want to have an exercise physiologist in this conversation? I think that because some people might not think that an exercise physiologist sits comfortably in this space.
Exercise physiologists are actually an integral part of a care team, which you embrace. And as a new profession, I think it's probably still not quite understood what we do and how we fit, but we work with the whole body, whole person. Yes, we work with, muscles and bones and physiology, but we also work with lifestyle interventions and the complexity of chronic pain, especially endometriosis and pelvic pain, and we know how complex that is. And we are there to support not only like physical exercise prescription and breathing and moving, but working with the nervous system and neuroscience. And this is where I get a little bit nerdy and nerd out. But that's my passion, is to help people who are in pain, particularly those with persistent endometriosis and pelvic pain who may have gotten lost in the system as well, and know that there is hope and there is things that you can do. And as a team, we're here to support you.
Endometriosis and pelvic pain so needs a team, don't you think?
Absolutely. Absolutely.
So in our clinic, it would be really common for someone suffering with pelvic pain, endometriosis, to perhaps have a team that involves a GP. It often will include other allied health, including exercise physiology, might be pelvic physio, sometimes dietitian, sometimes psychology. And then there's other non-GP specialists get involved as well. So classically the gynecologist, but there's others as well. There might be a pain physician, there might be a gastroenterologist, might be a colorectal surgeon. Like there's so many people who might get involved.
Absolutely. And I think it's important to point out perhaps why we're here. Well, and I know that part of my journey in my career is with education. I was previously at UniSA, so I do love the education space, and that's part of my role as an exercise physiologist, but do enjoy our group sessions that we run, and also modes like this where we can educate and hoping to reach a broader audience. So not only as a health practitioner, I enjoy the education part as well.
So we're thinking about a team, which means that we get an opportunity to drag in various members of the extended endometriosis pelvic pain team from across Australia. Is there anyone in particular that you're thinking that you'd really love to interview? Because that's what we're about. We're about let's get some experts in and let's ask them all the questions that someone else at home might be wishing that they could.
Absolutely. I think other pain specialists are going to be a good one.
Mm-hmm.
The pelvic physios, absolutely.
Yeah.
The leaders in this, or the pioneers, if I use that term, the pioneers in the industry that have led the way before it was even a thing, before we even got some media attention and this started to be recognised.
Yes.
You know, what's happened, what's been happening that we don't know about.
Absolutely. And the people who have been the real trailblazers are the people that we're wanting to get in. So Associate Professor Susan Evans, we would love to interview. Professor Louise Hull, who was one of the OG researchers in this area, is now a professor in fertility and gynecology. Let's talk about the trailblazers in ultrasound and imaging and what's happening now with diagnosis that might not need surgery. Let's talk to some endocrinologists perhaps, or hormone specialists. Let's talk to the physios.
Everyone who has their unique niche and specialty. I think that there's just such a wealth of knowledge there, like even with bladder and bowel, and people not recognising that this syndrome actually affects other parts of the pelvic area and beyond.
Yes. And it's not always about what the endo might be attached to. There's other things going on as well, the nervous system, the immune system, the hormone system, the gut, the microbiome. Like, it's so complex but also so fascinating. So I can't wait to see if we can really look into some of these areas and really shine a light on them.
Absolutely. Go deep dive.
There's so many things we could cover.
And getting experts around the table to discuss and explore and learn some things, because when, I'm not an expert in everything. It's around.
Absolutely. And as a GP, whilst I continue to gain expertise every time I work with someone and every time I see a new person and we go through a journey together, I'm still gathering and learning information as well, and so is the rest of the medical community. I mean, some of my mentors and some of the people I look up to say facts have half-lives. So even what we thought was true in this space 10, 15 years ago, perhaps we can look at with a different lens now. And who knows what's happening in 5, 10 years. Well, I actually hope will look quite different again, because there's just so much we don't know about this space.
How long have you been practicing specifically in this space for now?
There's a couple of different ways to answer that, I guess. So it's been about 2 years since we were awarded the federal government grant to really work in a focused way. But as a GP, I've been working as a GP now for about 15, or in general practice for about 15 years, about 10 since being a card-carrying general practitioner. And as a female in this space, I've been looking after seeing women with complex issues since day dot, really. So, yes, I'd say 15 years or perhaps more, but in a very focused way for, say, the last sort of 2 to 5 years. And I keep learning and I keep seeing new patterns.
What's your biggest takeaway in the last couple of years?
My biggest takeaway is that that the bit that we see and we acknowledge around endo and pelvic pain is the tip of the iceberg. So there is so much going on in anyone that I see, and the deeper you dig, the more you find. And some of those things that you find are unexpected, and some of the overlaps with other conditions are unexpected. And they are also things that I'm really looking forward to being able to explore on this podcast too. So what keeps appearing to me is not just the initial, what's happening with pelvic pain, which we'll cover, of course, but then also what overlaps. So neurodivergence overlaps, hypermobility overlaps, autoimmune conditions overlap. There's so much else going on that surprised me. And again, you ask me in 5 years and I'll probably say a whole bunch of other things as well. That's what I love about working in this space.
What have you learned about yourself?
Knowledge is my love language. So not only do I find that in myself, that the more that I love being able to sit down and learn something new and be able to pick other people's brains and put together a picture in a new way, but I love doing that for others as well. So I love the opportunity to help other practitioners around me learn more too. And that's been something that's been wonderful about having access to the federal government grant that we've had, is that we've been able to upskill as a team. So we've been able to look into some of those different areas, whether it be ADHD, whether it be hypermobility, whether it be dysautonomia, which is something that we'll talk about in future podcasts. And I guess as an extension of that, it's sharing the learning as a love language with our audience as well.
What advice would you give a patient who's listening to this as a first episode right now?
Come with us on this journey. And if you've got questions or comments, can you share it with us? So I've started the Instagram page, Endo Untangled. So write to us on there, hit us up on social media and ask us the questions, because if you've got a really burning question or a really good question in this area that affects others, then you and I are going to go and dig it out together, aren't we? We're going to find answers.
We're going to find the answers.
Yes. Anything you want to share, Cherie, before we move on to the rest of the podcast?
I think I'm just excited to go on this journey and meet and ask lots of questions. Anyone who knows me personally knows I love asking questions, the difficult questions. I hope to be an advocate for patients. So again, I'd really encourage you to put the questions out there so that we can pick them up and really get them answered as best we can. Let's do it.
Yeah, let's do it. Come along with us.